The pelvic floor muscles lie across the base of your pelvis, from the symphysis pubis at the front to the coccyx or tailbone at the back, and help support the pelvic organs, the bladder, the uterus, cervix, vagina and bowel. These muscles also have a vital role in bladder and bowel control and are important for sexual function and sensation. A key part of the postnatal recovery is to start the pelvic floor muscle exercises shortly after birth. It is important to get the right muscles working in the right way. In a comfortable lying or sitting position, imagine that you are trying to stop yourself from passing wind and urine at the same time, drawing the pelvic floor muscles upwards and forwards from the back passage towards the bladder. You may feel a lifting up and tightening as your muscles contract. Try not to hold your breath and breathe normally. Your lower tummy may tighten, which is normal, but keep your buttocks and legs relaxed. Let your pelvic floor muscles relax fully after every contraction. You or a partner or the midwife can check if you are contracting your pelvic floor muscles correctly by looking at the area between your vagina and the back passage, known as the perineum, and see if this area is drawing inwards. Pelvic floor muscle exercises are important after every birth and should include long held squeezes as well as short quick squeezes, ensuring that you let the muscles relax after each squeeze.
To do your pelvic floor exercises, squeeze and lift the back passage as if you're trying to stop wind, then continue the squeeze and lift to the front as if you're stopping the flow of urine. Try not to hold your breath or contract your buttocks or legs. Let go fully after the contraction. Repeat long contractions, lifting and holding the muscles for up to 10 seconds before releasing. Give yourself 5 to 10 seconds rest between each contraction. Aim to do this up to 10 times or until your muscles tire. Then repeat short contractions by lifting and releasing until your muscles tire, which may be up to 10 times or more. Do the short and long pelvic floor contractions 3 times a day, starting as early as you can in your pregnancy and continuing after having your baby, once any catheter has been removed. Using the NHS Squeezy Pelvic Floor app is a good way to gain motivation and guidance.
As a reminder, try linking the exercises to a daily habit. For example, every time you feed your baby, and make them part of your daily routine. Doing these exercises regularly will help the muscles rehab and become stronger, reducing the likelihood of pelvic floor dysfunction. Here at Salisbury, we have the Perinatal Pelvic Health Service, run by a specialist midwife and a specialist pelvic health physio, to support you during your pregnancy and up to 1 year postnatally. So if you find you're experiencing any signs or symptoms of pelvic floor dysfunction after having your baby, such as urinary urgency, urinary leakage or incontinence, bowel urgency, anal leakage or incontinence, wind, flatus incontinence, painful sex or pelvic pain, please visit the website on screen, or alternatively scan the QR code on the blue sticker located on the front of your baby's red book for further information, and make a self-referral into the Perinatal Pelvic Health Service for further support from our team. Opening your bowels. After having your baby, the thought of opening your bowels can be daunting. However, it is safe to open your bowels without any damage occurring to your perineum or stitches. The following advice will help you reduce the chances of infection and discomfort in the first few days postnatally. When opening your bowels, you may find it comfortable to hold a clean sanitary towel against your stitches so that you do not feel like your stitches are splitting. Eat a high fibre diet, fruit, vegetables, brown bread, pulses, and drink plenty of water, 1.5 to 2 litres, to keep your poo soft and avoid constipation and putting any strain on your stitches when opening your bowels. Try adjusting your position on the toilet to represent a squatting position, and take some calm deep breaths, as this will change the angle of your rectum and allow the stool to pass more easily. If you are finding it difficult to open your bowels, you may need some medication to soften your poo. You can get advice on this from your midwife, GP or local pharmacist.